Medsearch, 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 Healthcare Simplified.
I'll start now. Welcome everyone to today's presentation. I'm your presenter, Zanga Musakuzi, the CEO of Medsearch Zambia and co-founder of the company. Just a brief background of what Medsearch is all about. So Medsearch Zambia is a Zambian-owned company that has developed an application, a mobile application. We call it a mobile medical application. What is it all about? The Medsearch Zambia app helps each and every Zambian, wherever they are, regardless of their location, be able to find the nearest pharmacy, nearest hospital, nearest lab, where they're able to do their test from, where they're able to find medication from, where they're able to find any health services. So a long time ago, people used to move from one pharmacy to another looking for a drug that has been prescribed for them. So we developed Medsearch to help such people. All you have to do is, if you don't want to search for a pharmacy, you can search for a drug using the application, and the application will tell you where exactly you can find that drug. So no need of moving up and down. Are you looking for a cardiologist? Are you looking for a nutritionalist? The application will be able to help you. In the same line, Medsearch Zambia is helping small to medium health business owners become more visible, not only to their local people, but even beyond. So it is more like we're increasing their visibility. Increased visibility, increased customer run-in, which in turn becomes income. So today's topic is irrational use of medication. It is a serious problem in Sub-Saharan, a serious problem globally, because this is affecting everyone and this is being done by everyone. Yep, thank you very much for those comments. If there'll be any question, please do type them in and I'll be able to answer them. So we can start by defining what is irrational use of medication. Irrational use of medication may be defined in two ways. One, the use of a medication for not its intended purpose, which is very common now. So a drug, most of the time we use medication, if you're not feeling well, a drug is prescribed for you for a certain condition, for you to become better. Irrational use of that drug comes when that medication is being used for something else. And at the moment, the most abused medication is codeine. Codeine is an opioid that is used as a painkiller. I will not go into details and become more scientific because I know this is for everyone, medical and non-medical personnel. So I'll try to be as non-medical as possible, but try to deliver the message. So you have a drug that is intended for something but is being used for something else, and majority of bus drivers, taxi drivers are using it to get high. So that is irrational use of medication. That is one definition. The other definition of irrational use of medication is the use of medication legally by a wrong person. So let's say I went to the hospital. I was found to have a cough, and this cough, the doctor or the physician goes on to say it's a bacterial cough, and they go on to prescribe the famous amoxicillin for me. If I start taking that medication, I get better. I don't finish the medication, and someone else at home starts to use that medication without a medical personnel prescribing that drug to them. That also becomes irrational use of medication, because that drug or that medication was not prescribed for you. So irrational, one way, using a drug for not its intended purpose. Also using of a drug by not the prescribed person for. So that is the definition of irrational use of medication. The scope of irrational use of medication globally is going high. Uh, 2 years ago, it was more of the middle-aged people, 30 to 45. Uh, Majority of them were using, but now it is more like a lot of youths and adults are misusing the medication. So we had a problem. It was something small, but now it is growing day by day, year by year, and it's becoming a huge problem. So the scope of this irrational use of medication is becoming big, and it's becoming dangerous. It's becoming uncontrollable, if I may say, for lack of better terms. We're reaching a point where we're unable to control the irrational use of medication, and this has got repercussions, a lot of them. I don't want to take long, so I'll be rushing through. What are some of the examples of medication that are being misused? Number one, the famous group are antibiotics, especially in the sub-Saharan. Antibiotics are being misused not by people who are prescribing it, but by patients, the end users. The famous medication here in Zambia, the ones that we misuse a lot: amoxil, Septrin, Flagyl, Pen-V. It's more like whoever goes on to have a cough, these things someone will jump on, will start using. Even if an antibiotic was prescribed for me, if I get better, if someone in the house starts to cough, without even seeing a medical personnel, that person will start using the medication. And this is becoming bad, because now if that person who was not prescribed that medication becomes worse, when they go to the hospital and we have to now start treatment on them, it becomes difficult, because the first line medication that we feel like this person should start on has already been utilized. At home, they had already started taking antibiotics. Now this becomes difficulty for us. Now we have to find a different antibiotic that is able to help that person. So antibiotics are being misused. Antibiotics are being used irrationally here in Zambia, and even in your homes. Especially for cough. I think we're all guilty of it. If anyone develops a cough, the number one drug that comes to our head is give the person Pen-V, give the person amoxil. There are some coughs that are not bacterial. Maybe they're just allergic to something. Maybe it might be just dust. But straight on, we give people to start taking antibiotics. Stop it. That is irrational use of antibiotics. And because of that, we, in the pharmaceutical world, we're facing one big challenge, and that is antibiotic resistance. A lot of bacteria that are attacking people are becoming resistant to the many medication that we have, and it's already a major problem, because this means now we have to come up with a new group of drugs that are able to do a job that the old drugs were doing, and this is expensive. Moving from something that we're able to afford, an affordable antibiotic, to something expensive, majority of people will not be able to afford buying antibiotics. So from us as Medsearch, do not start taking any antibiotic without a physician prescribing it, or without going to see a pharmacy personnel. And if you're in any area, the best thing that you can do is use our application. It will be able to tell you which pharmacy is nearby. If you develop a cough, the application will be able to tell you which pharmacy or hospital is nearby, so that you're able to go there, and they'll be able to direct you whether you should use just a normal cough syrup or an antibiotic. But most of the time, majority of the coughs that we go on to have are just an allergic seasonal coughs, which don't even need an antibiotic. Some of them are just viral, sore throat. Majority, 70-80% of the sore throat is not even bacterial, but you find if someone gets sick, the first antibiotic that we use for sore throat is Pen-V, which isn't the case. We are putting our lives in danger. We are slowly killing ourselves with overuse of antibiotics. So that is one group that is very misused in our homes. So if you have any antibiotic, the best thing I can encourage you is hide them from other people using them, or return them. If you bought them, return them to the pharmacy that you bought them. They'll be able to discard them in a proper way. If you got them from a government hospital, take them back. They'll be in a better position to discard them. So antibiotics. This is a plea. If you have any infection, or if you have developed any sickness, do not put yourself on any antibiotic. Visit any health facility. Please visit any health facility. The second group of drugs that has brought addiction, that has brought misuse, which has led to addiction, are the opioids. Now, opioids are medication that are used for pain relief. They work on the opioid receptors in the brain and in the spinal cord. So we use them to relieve pain. But now we are seeing an instance, or we're seeing a scenario where opioids are being misused because of their side effects. So a side effect is a negative effect of a drug. If you take a drug, there'll be the positive effect that we want to achieve. If you're in pain, if you're in severe pain, we're able to give you one drug which is common. We're able to give you tramadol. It's okay, because we're trying to treat the pain. But the negative effect, the 30% negative effect of a drug are the side effects. It will cause drowsiness, and it will make a lot of people feel that euphoric feeling high. This, because of those negative effects, this is what is leading to many people, especially youths, misusing the medication. Opioids, an example of opioids is, like I've said, codeine, fentanyl, oxycodone. At the moment, currently, these are the drugs that are being misused by many people. The doctor might prescribe it for you for pain, but later on you find that people now become addicted to it, because there's that feeling of, you take it, you start feeling drowsy, you're able to sleep properly because the pain has gone away. But now people become addicted to it and start misusing it. So opioids, the problem with opioids is that there will come a time when you need to take an opioid. Maybe the pain might go away, later on the pain might come back because of misusing opioids. One thing that will happen is that for us to achieve our target, for us to achieve our aim of alleviating pain, we need now to increase the dosage. And this is what is leading to many people becoming addicted to opioids, especially bus drivers. I think we've seen a lot of them buying a cough syrup with codeine, becoming high. The problem is that today I might take one tablet of a certain drug, of a certain opioid. Tomorrow I'll require about 2 tablets just to feel the same effect of drowsiness and euphoria, for me just to feel good, for me to feel high. So opioids are being misused, and this is leading to drug addiction and drug abuse, because people now become addicted. They cannot do anything without taking that drug. If you have any question, please feel free to post them, to write in the post, and I'll be able to respond to them. So we've looked at antibiotics, and we've also looked at opioids. The third one is CNS depressants. Now, CNS depressants like benzodiazepines, phenobarbital. Although these are not common on the market, usually these are common with health workers because they've got access to them. And these are prescription medication. So majority of the people, when they take them, one thing that these medication will do is they'll make someone become drowsy. And no wonder majority of the people take it, the CNS depressant like the benzodiazepines and phenobarbital. The problem again with such medication is that you become addicted to it, and for you to feel the same effect, the same feeling that you had 2 days ago, you need to double your dosage. So you now find someone who was just taking 1 tablet will now start taking 2 tablets, from 2 tablets to 3 tablets. Now the problem with such drugs is that they've got a bad effect on the liver. So a lot of people are now entering into liver failure, which is really, really bad, and we know how important the liver is. Irrational use of medication, which is very, very bad. These are the 3 groups of medication that at the moment are really being misused by many people. Number 1, we talked about antibiotics. Whenever someone feels sick, whenever they feel a cough, whenever they have a stomach pain, even if it's not a bacterial stomach pain, people rush to using medication. People rush to using antibiotics. Stop it. Do not use antibiotics without seeing a medical personnel who's able to prescribe or advise you on how to take it. Thank you very much, Zelia. The second group are the opioids. The danger of opioids, you will become addicted, which is bad, and then it is just you need now to go through therapy. So it is something that is simple. You're able to take it, very okay, feel high. But the moment you become addicted to it, it will be a long journey for you to be stopped from taking them, which is not a good journey at all, because a lot of people now have real sickness, shivering, headache, when we're trying to withdraw them from such medication. And the third drug that we've looked at are the benzodiazepines, like diazepam and phenobarbital. These drugs, at one time, you will need them when you will get sick. But if you're going to be misusing them, the time that you will get sick, they will be more like irrelevant. They will not work, which will become difficult, which will be now difficulty for us to treat you, because the drugs that we have to treat you, you've been misusing them and you've been destroying your body. Stop it. So how can we prevent misuse of drugs in our homes? Number 1, when an antibiotic is prescribed to you, finish the course. I think this is common. This is common in majority. This is common in many of our homes. Average is 5 days for you to finish your antibiotic, but you find that people take the antibiotic for 1, 2, 3 days, even 2 days. The moment they feel better, they stop and keep that medication in their home. More like they're now keeping it for someone or ever is going to get sick. Finish your antibiotic. If you do not finish your antibiotic, you are creating resistance to that drug that you are taking. So that even next time when you get sick, if we prescribe such a drug for you, it will be difficulty for us to treat you, because the bacteria has become resistant to it, and it will become expensive treating you. Number 2, before you take any medication, if you're feeling sick or if you fall sick, go to the nearest health facility and see a medical personnel who will be able to advise you. Medications are not like any normal food where you're able to eat, you're able to give anyone, you're able to share. No. Majority, all the medications do have negative effects. All the medication become drugs are toxic, and they do damage the body to some extent. So before you put yourself on any antibiotic, before you start taking any medication, when you fall sick, go seek medical attention from either a physician, a certified physician, or a registered pharmacy or hospital. Like what we're doing now as Medsearch is we're trying to teach people to say, when you fall sick, look, use the Medsearch application. Download the app on your phone. It will be able to tell you which is the nearest facility you can go to if you're not feeling well. Where able to do your test from. The application will be able to do that. Do not self-prescribe any medication, be it a painkiller, be it an antibiotic. Number 3, do not share medication. Here's the thing. If I develop a headache and I go to a pharmacy, and they say, look, for that type, you've got a migraine headache, take ibuprofen and you'll be okay. If I become well, if any of my family members also develop a headache, I should not get the brufen. Just because it worked on me doesn't mean it will work and it will have the same effect on the person that I'm giving. Most of us are not medical personnel. You do not know what will happen if that person takes medication. And we've seen this in hospitals that we work. Someone taking a medication, and the medication that they took, they might have taken 2 tablets. 2 tablets to me is okay. 2 tablets to someone else might be an overdose, and that becomes a serious case. When you fall sick, when someone in your family falls sick, do not give them the medication that you had leftovers of your medication. No. If someone falls sick, let's follow the right channel. Go to the nearest health facility and seek medical attention. So, irrational use of medication. That is what I had for you. Irrational use of medication has been defined as using of medication for not its intended purpose, or using of medication by a different person than one that was prescribed for. That is already irrational use of medication. We looked at 3 types of medications that are being, 3 groups of drugs that are being misused. That is the antibiotics, opioids, and benzodiazepam. The CNS antidepressants. These are the drugs that are being misused. Our advice as Medsearch Zambia is that whenever you fall sick, do not put yourself on any treatment. Seek medical attention. Like I said, today is a Sunday, and I know majority of the people are preparing to go for work tomorrow. I don't want to keep you long. It was more like an interaction, a talk, you and I as we chat. So that was our presentation on irrational use of medication. Avoid putting yourself on medication. If you have any medication at home and you have, especially kids, this becomes dangerous. Put them away while they're unable to reach. Put away medication from a person that you think might become addicted to such medication. If you do not have a pharmacy in your home. That is our plea also. Do not have a pharmacy in your home. So that now whenever the whole community, whoever becomes sick, the number 1 place that they'll go to is your house, because they know that you have a pharmacy. No, the law will visit you. You might cause death to someone. Whenever you have medication that has remained, finish your antibiotic. If you have excess medication in your homes, especially painkillers, do take them back to the hospital, or do take them back to the pharmacy, and they'll be able to discard them in the correct way. My name is Zanga Musakuzi, CEO. I'm a pharmacist by profession, CEO of Medsearch Zambia. With this short presentation, thank you very much. Thank you very much for being part. It was interactive, and I've enjoyed those who've been sharing it. Thank you very much. If there are any questions, please do ask. If there are any questions, please do ask. I'm only remaining with about 5 minutes till I log out. So if there are any questions, please do ask. Hi to everyone who's joining now. So yeah, download the app. It's a medical directory application. It will help you and I find the nearest pharmacy, find the nearest hospital. The application also makes you know the pharmacy that is near you and what medication they stock. The application allows you to get all that information. What time do they open? What time do they close? What services they offer? For health facilities, it will give you the location, the phone number, and also what services they offer. So it might be cancer screening. Use the application. It will help you know where you're able to do your prostate cancer screening from, your cervical cancer screening from. And one of the updates that we're trying to do to the application is being able to make an order using the application and make an appointment using the application. So download the application. It's a Zambian product. Let's support Zambian products on the market. Seems like there are no questions. Thank you very much for joining in. Till next time, continue liking our page, continue sharing our page. Medsearch is there not because we are health personnel or because Medsearch is big. No, Medsearch is Medsearch because of
Medsearch, healthcare.